Hey, everybody. Welcome to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelsen, professional horse trainer. And with me today is my sissy, Dr. Gretchen Nelsen, equine veterinarian, also my horse's veterinarian. And today's topic, Gretchen is going to, Dr. Nelsen, how do you want to be addressed? This is difficult.
Gretchen is fine.
Gretchen is fine. Okay. So Gretchen's going to share with us the ins and outs, what we need to know about laminitis as an issue. And so kind of assuming we don't know anything about laminitis, which is a major issue for a horse, can be life-threatening. The questions I have for you, Gretchen, are: what is laminitis? What are the causes of laminitis? What are the symptoms of laminitis, and when do we need to call the vet? And then, is there anything we can do first aid treatment? Because sometimes it takes a while for the vet to arrive, especially even in an emergency. So what are some first aid things we can do for laminitis? And then finally, what can we do to avoid or prevent or try to make a detour around ever having the issue of laminitis? So we'll start with question one. What is laminitis?
What is laminitis? So first we'll say, what is the lamina, which is what is, so laminitis just means inflammation of lamina. And the lamina is the blood supply and supportive structure within the hoof. So you have the coffin bone sits inside the hoof capsule. The hoof grows down from the coronary band, just like your fingernails grow from your cuticle, and you have a bone under there as well. Well, with horses, they're walking on that. And so the lamina is the soft tissue blood supply supportive structure that lives between the inner lining of the hoof capsule and the top of the coffin bone. And it looks like little finger projections that interdigitate with each other. So if you look at it under the microscope, it's all these little loops that are coming out, and they're just kind of interlocking between the bone and the hoof capsule. And that's what brings blood supply to the hoof itself, like the hoof capsule, as well as to the outer layer of the bone. There's also a major artery that runs through the bone itself, but this lamina is what just kind of holds it all in place.
So when the lamina is the blood supply. Is it directly behind the hoof wall, or is it like hoof wall, white line, then
so it's hoof wall, white line, lamina, bone?
Okay, and from the outside in.
Yeah, from the outside in. So it's the hoof you can see, and then underneath that, which is, white or black, depending on your horse's color, under that lives the white line, and then under that lives the lamina. And then that is interdigitated with the lamina that's coming off the top of the coffin bone itself. And this is happening in a 360 degrees. So it's going all the way around the hoof. It's, the bone itself. So when you get laminitis, you're getting inflammation in there. And so it's literally a soft tissue structure that's stuck between a rock and a hard place. And so what breaks down is the soft tissue structure. So when you get inflammation, you get swelling. When you get swelling in the foot, you've got a hoof capsule that's not going to stretch. You've got a bone that's not going to give way. So what breaks down are those little finger-like projections into each other. They start to separate. And then because the deep digital flexor tendon comes down and inserts on the bottom of the coffin bone, it is constantly pulling on the coffin bone. And what it does is pull that bone away from the top surface or dorsal surface, and that's what creates rotation. When you have really bad laminitis and it goes all the way around the hoof, then you get sinking. And that's where all that supportive structure is giving out, and the bone literally sinks down within the hoof capsule and gets closer to the outside world, which is not a good place to be.
Okay. And you corrected me years ago where I was confused between the term founder and laminitis, and that we can have founder is, my understanding is, it's just kind of the layman's term for laminitis. It's one and the same.
It's more referred to, essentially, yes, but it's more referred to the chronic state. So usually when you've got a horse where they say he's foundered, he's gone through that initial lamina insult and has had rotation and changes to the foot that you're dealing with. Because some horses can get laminitis and not have rotation and be
So,
corrected and go back. And so the laminitis is the initial acute occurrence.
yeah,
And so it's all horses with laminitis, or all foundered horses have laminitis, but not all laminitic horses are foundered.
okay.
Yeah.
That's, yeah.
So
And those two
it's,
terms are used pretty interchangeably.
yes.
And so you can also have basically inflammation without the bone moving at all, the pedal bone or the coffin bone, or basically the bottom bone of the hoof. It doesn't necessarily have to move, but sometimes it can rotate. So what does it mean if the bone rotates?
So that's where the deep digital flexor tendon pulls the bone away from its location that it's supposed to live in. So like when you x-ray a foot, a normal foot, the top surface of the coffin bone should be parallel to the hoof capsule. And so when you get rotation, that tendon has pulled the coffin bone. So instead of being at this angle, parallel to the hoof capsule, it's now tweaked and
So it's,
rotated in a downward motion. And so it has a more upright appearance. And those of you with horses that have a club foot, that's one of the things. It's a healthy foot, but it's in this more upright position.
where
And
the toe is
so,
pointed more towards the ground than it is kind of
correct.
parallel over the ground.
Right. And what that does too is create a thinner sole. It makes them very footsore and all that, but it's a change. So you can have laminitis that can lead to rotation, that can lead to sinking.
And what's sinking?
The sinking is when it gives out all the way around and the whole bone, rather than just rotating, literally sinks within the hoof capsule.
So it drops
because there's
down.
there's no supportive structure. So it's actually lower than it should be.
So it increases space between the bone above it and drops lower towards the sole of the foot.
Not necessarily between the bone above it, but more that the hoof capsule. So it's like the coffin joint is supposed to sit right at the coronary band, and all that just kind of shifts down.
Oh, the
And the
whole
whole leg
capsule
is coming with it.
Okay.
Yeah. So it's the hoof capsule that it's sinking in.
And would you say that's like the most extreme version of laminitis or founder, that's kind of the most life-threatening, is the sinking or the rotation?
The ones that sink have a poorer prognosis. So if they've actually sunk, it is a more guarded, we would say, guarded to grave prognosis. Whereas a horse that's just had rotation can have a guarded to good prognosis. And then a laminitis without any rotation has a very good prognosis.
Okay. And once the bone is rotated, it's going to rotate in degrees from away from normal, or where it should be, with the toe tipping down. And once that happens, can it ever go back to normal, or is the rotation stuck there now forever? Is that just the new normal for the horse?
You can change it through varying degrees of treatment, which we'll go over in the next section on the treatments parts. And so there are things you can do to change that angle, and it has a lot to do with trimming. And so the best thing for a laminitic horse is a good farrier. That's where it really helps the most, is a good farrier and a vet that can diagnose the cause of the laminitis and then treat accordingly and get that horse back in a stable position. But I always say every laminitis case is different, and you just never know. I've seen some that looked not so bad really go crappy. So it can be highly variable, and that can lead us into basically like the causes of laminitis.
Exactly. I was just thinking that. Question number 2, the cause. What causes laminitis?
So we break that down into basically 3 categories. The most common, easily over 80%, if not 90%, of horses with laminitis are caused by endocrine related which also includes pasture related, because usually it's horses that have an imbalance to their endocrine system, which is your hormonal system that regulates your body. And we'll see it with horses with what we call equine metabolic syndrome, which is kind of like your type 2 diabetes and high insulin resistance. We see it in horses with Cushing's or pars pituitary intermediate dysphagia, which is issues with the pituitary gland causing elevated steroid in the system. And then the pasture associated is carbohydrate related, which is usually also related with horses with EMS or PPID. And so that one kind of falls within it. And then the second
EMS, equine metabolic symptom, and PPID is
pars pituitary intermediate dysmorphia.
okay. So for horse owners, that's basically insulin resistant, Cushing's, Cushingoid, yes, and anything like that. And then what you're saying about the pasture is what everybody knows: don't put your horse out on super rich spring grass because they can founder or they can have a laminitic episode.
Right, because of the sugars that are within it. But it's like your normal horse that doesn't have EMS or PPID are less likely to have the pasture associated. And so it's those big chunky ponies, any of your horses that, you know, are super easy keepers. Those are always the ones you want to be a little bit more careful with. But any horse, it can happen to any of them, if they go from no pasture to a lot of pasture with that spring grass and lots of sugar.
And it's basically a carbohydrate spike, which is also why we're supposed to introduce more carbohydrates in the diet slowly. So like if your horse has been on a straight hay diet and you suddenly give a scoop of oats, that carbohydrate spike can create a laminitic episode.
Correct. And it can do it in two ways, because it can be the sugar factor that we were just talking about. And then the second category of laminitis causing is sepsis associated, which one of those can be a grain overload. So that's the horse that breaks into the feed room and eats half a bag of oats. That's a, yes. Call the vet immediately, because the way that you prevent problems with that scenario is the vet coming and pumping the stomach and literally lavaging out as much of that grain as possible and doing preemptive steps to stop the laminitis. Also in the sepsis category are things like mares that retain their placenta after foaling, or horses that have severe colitis, like they could have an antibiotic associated colitis. They could have a toxic plant associated colitis, a really severe colic.
Basically, as the horse owner, raging diarrhea.
Yes. So raging diarrhea causes a toxicosis, retained placenta. So all those things can lead to an endotoxemia, which means toxins throughout the body that then affect the blood flow to the foot that then cause the laminitis. So that one's more.
I think what's not often talked about too is even steroids and joint injections, if they're not done properly. Like I had one client who the vet did multiple injections in one day, and the horse had and the horse foundered. So it's even that, like not having a conservative vet, shall we say, giving joint injections, that I would guess is in the category of sepsis as well.
That would be more if like the horse got an infection associated with the joint injection that went septic. But the like overload of steroid use in the example you gave with the vet injecting so many joints at once, that's almost more like putting it into a Cushing state. So it's so much steroid rather than necessarily sepsis.
So it's affecting the endocrine system.
Yeah. Okay. Because it's a lot of steroid at once. And because the majority of steroid injected into joints stays in the joint, but it can go systemically. And so we know with certain steroids, you never want to use more than like a total milligram amount. So if I have multiple joints I need to inject, I'll get the best results by doing like the hocks one day, come back a month later, do the stifles.
Mm.
rather than doing both stifles and both hocks on the same day, because that means I'm going to have to use less steroid in each joint and get less result in each joint.
So
So
it's
to get the best, it's better to be patient and spread your joint injections apart than try
as
to do it all in one fell swoop.
okay. And that's a surprise to a lot of people that there's even that risk with joint injections. I know people are aware of the risk of infection, but not necessarily how too much steroid could affect and actually induce laminitis.
Yeah. And a lot of it depends on the horse. Like if it's a horse that's kind of sitting on the edge of insulin resistance or sitting on the edge of Cushing's, and you do a lot of steroid injection, that's what can kind of tip them over.
Ah.
And so it can be horse related as well, but nobody has a crystal ball and can know
And
for
so
sure. So it's
both of the causes you've described so far, would you say that's when people are kind of in layman's terms referring to a metabolic laminitis? Those are the two things you've described so far would be sort of metabolic issues.
the first one's a metabolic. Yeah.
Okay.
The second one, sepsis, isn't like an infectious, toxic kind of situation. Like it could be from a, infection in the bloodstream or some kind of toxic insult or something like that. So it's not this, the first category is more metabolic.
Okay.
The second one is more toxin. And then the third one is a mechanical one that we call supporting limb laminitis. This is where, like Barbaro, the racehorse, broke one leg. He had surgery on that leg, but was still non-weight bearing. So his opposite foot had to hold all that weight for an extended period of time and created laminitis in that foot because it was just too much weight bearing for too long. So that one's a rare occurrence. As far as all the laminitis cases out there, it's probably less than 1%, but it is a factor that if you have a horse that has a major injury to one leg, you always have to be prepared for laminitis in the opposite foot because
Good
it just can't hold that weight for a long time.
Got it. No, in a broken leg, that's a long time. So but even like a tendon or ligament injury on one leg, the horse is going to be more weight bearing on the opposite leg is where you're risking the laminitis.
Yeah, like I had a case where it was a pregnant thoroughbred mare. So she was 10 months pregnant. So that's a lot of extra weight, had a severe hoof abscess. We did everything we could to get that hoof abscess open and draining. But all it took was a period of about 4 days where she was essentially like barely weight bearing on that foot with all her extra pregnancy weight to make her severely laminitic in the opposite foot. And she ended up having to be euthanized.
Oh,
and
geez.
And it was one that it was just, we could not get enough support on the opposite foot because of all the extra pregnancy weight.
Yeah, and that's the seriousness of laminitis. It's not just soreness and mild inflammation. It's kind of like you said, it's between a rock and a hard place where there's nowhere to go. And so it is a life-threatening issue for horses. Absolutely.
Yes.
And then what about like if you have a bad farrier, if you have a farrier who is not doing a good job, can your farrier induce lam? And this is not to bash farriers. This is just to educate owners. But the hoof trim itself, can that create any kind of mechanical laminitis issues?
It can. I mean, that would fall into that category of inflammatory laminitis, that there's enough change to the mechanical structure, or because like you'll get some of those horses that are ouchy for 1 or 2 days after the farrier trims them maybe a little shorter than they usually do. And that's not technically laminitis. That's basically like a person that always wears shoes and socks deciding to go barefoot one day and they have super soft, sensitive feet. So when that farrier just trims that little bit extra sole, the underlying sole is just super soft. And so that horse is just more sensitive.
They're still gonna for a few days.
Yeah, they're tender footed. But if a farrier went in there and just like really severely changed angles, cut out the bars, just did some major changes to it, it could potentially induce laminitis. But those occurrences are also very uncommon.
Okay.
Like they really have to be aggressive. And that's where anytime I want to make changes to a foot, I go to a point where I'm like, okay, let's stop there. And then it's best to come back 2 or 3 weeks later and do a little bit more rather
And
than
change, right, change
make
the
your
angles
changes
of the feet
slowly.
slowly.
Yeah.
Great. And that kind of leads into the third question of what are the symptoms? Like how, as a horse owner, would I know or suspect my horse might be having a laminitic episode? Like what would I see my horse do? How would I know? When should I call the vet?
Yeah. So it can range because it all depends on how severe the laminitis is, but it can be as mild as coming out of the stall just a little more tender-footed than usual. Like they come out of their nicely heavy bedded stall onto a concrete aisle and they take a couple ouchy steps while they're on the harder surface. And then you get them out to the soft surface and they seem to walk fine. That can be one of the like most mild symptoms. Going up to obvious lameness at a walk where they're head bobbing lame and oftentimes it'll look like one foot. Like I had a case where it presented as one foot. I blocked that foot, made it comfortable, and then the horse went lame on the opposite foot. And so I had to figure out, like, is this navicular syndrome? Is this laminitis? Is it just super soft soles? So then you have to figure out what's going on. But it can be anything from slightly tender-footed all the way up to the classic laminitis sign of rocking weight onto the back legs where they want to get off those front feet, because the majority of laminitis cases are going to start in the front feet, mostly because when horses are standing, 60% of their body weight is on the front feet. And so it takes more of an insult, therefore they get sore before the back feet. In cases where I've seen it in all 4 feet are almost always toxin related. So it's that second category. When you've got a retained placenta, say you've got a horse that had a twisted colon and went to surgery and they untwisted it and it had already started kind of changing color and it wasn't totally dead, or they took out dead bowel. Those are all horses that are at risk for toxic laminitis, which usually affects all 4 feet because it's that toxin just going throughout the body and hitting all of them.
And that horse would probably be lying down a lot.
A lot, because all 4 feet are sore.
Right.
And so that's kind of your
when it's
classic.
the front feet, they kind of rock back and they extend their front legs out in front of them like a half of a downward dog position almost. And they kind of rock back.
Yeah. And then when they do walk, they're trying to keep their weight off the toe. So they do this kind of stilted, choppy little walk where they're trying to keep the weight on the heels. And many people refer to it as like walking on eggshells kind of thing, where it's that short little, because basically they're trying to get off of each foot. And then when they're standing, the classic bilateral laminitis is shifting weight from one front foot to the other quickly. So
just
it's like when
shifting back and forth, can't get comfortable.
Just cannot get comfortable. Like your normal horse, when they stand in the cross ties, they might shift their weight to one foot and kind of stand that way for a little while, then go back to all 4, maybe shift again. But the laminitic horse is kind of that. For some of them, it's like every 15 seconds. For others, it can be every like 45 seconds. They're just trying to get that weight off the other foot to give it a little relief. So, and then the other one is the increase in the digital pulse. So your digital artery lives, the easiest way to find it is right at the back of the fetlock. It's living at that kind of just off the midline. It's probably about, I'd say a half a thumb's length from the very back of the fetlock. You go to the inside and to the outside. So I usually put a thumb and a finger on it, and they should be hard to find. So
if you can be able to easily feel a pulse there.
Right. If you can feel it, like it should be a very subtle little pulse going through, or you might have a really hard time finding it in a normal horse. In a laminitic horse, it's often easy to find. And so that would be an increase in digital pulses. And if it's super inflamed, there'll be what we call bounding, where you can actually see them pulsing. So if you look down,
the veins really jumping, it's like kind of sticking out. So it's maybe enlarged, easier to find, easier to feel. And
it's the digital artery. Yeah. Because the
Okay.
reason it's increasing is because there's inflammation in the foot, which is creating a higher pressure. So the body has to push the blood harder to get it into the foot because of that inflammation between the hoof capsule and the bone. And that's what makes the pulses become more obvious. Because of the increased pressure, the blood vessel has to, the heart is pumping it down there. And in a normal horse, it just flows on down, does its thing, comes back up the vein. But
so
in a
if we
horse,
put our fingers on the back of the fetlock and we can easily find a pulse that's obvious, that is not good.
not good,
Not good.
not good. So
yeah, if we can hardly feel the pulse, or if it's kind of mild, it's slightly better. If we can't find the pulse at all, it's a normal horse.
right.
And if we can find it easily and it's bounding, doesn't necessarily have to be rapid, but bounding means more obvious.
Correct.
Okay.
That you can literally see it pulsing.
Okay.
That's what a bounding, like if you just look at that fetlock, you'll all of a sudden, you'll see kind of a bulge towards the back on the side and on the inside, on the outside and the inside. And that artery will literally be pulsing.
Okay.
And if you can see it and feel it easily, that means you have inflammation in the foot. Now, the one little caveat, so owners don't get hysterical sometimes when you've got, if they're really lame on one foot and it's obviously one foot, your biggest factor is most likely a hoof abscess.
Because you can still get a bounding pulse with a hoof abscess.
Correct. And
Okay.
you usually get it on the opposite foot because they're standing on it more and creating more pressure in that foot. And so a lot of times the foot with the hoof abscess, they're not standing on it. They're hopping, they're toe touching. So that pulse may actually be normal, but the opposite one may actually be a little bit inflamed. And so that's usually usually with a hoof abscess, you're going to have one leg that has an elevated pulse. And in laminitis, it's going to be both front. And so that's one way to kind of differentiate.
Okay.
And then the other way is by your farrier or your vet hoof testing that foot and knowing where it's sensitive and being able to differentiate.
So basically, as an owner, if our horse is starting to look off, if they're sort of shifting weight back and forth every minute, and if we can feel a significant pulse, especially on both front legs, it is time to call the vet.
Yes.
Okay. Answers. And if we open the stall door and our horse is rocked back and halfway to downward dog, call the vet immediately. And you probably have bounding pulses if you check. But that stance is, and I'm mentioning that because with, like you're describing, the metabolic or the toxic laminitis, it can come on suddenly. Like I've had a horse that was fine on Thursday and Friday morning leaning back in the stall. No clue it was going to come. And that's how fast a metabolic or a toxic laminitis can occur. So that the rocking back, trying to get weight off of both front feet, or really easy to find strong pulses in both front legs, immediately call the vet. Even if the horse doesn't look that off.
Right. No, but those are just your classic laminitis. And that's where, that kind of mild iffy, you're not quite sure, then the things that you can do, like you can call the vet. And if the vet can't get there that day, some things you can do are, number one, take them off grass. Just assume what I always tell people whenever I look at a horse where laminitis is on my list of things it could be, I assume laminitis until proven otherwise. Because
that's a safer thing to do. That's
a safer thing to do, that you just assume it until proven otherwise, because it can be so detrimental. And so that's where I always do the things that are going to help, which is get it off any kind of carbohydrates if it's on it, get them in a stall that's nice and thick and heavily bedded with things that are really hoof conforming. So you want things like sand or really fine shavings, but you want that cushion and depth. And it also kind of encourages your horses to lay down, which is the best thing, to get them off those feet and allow that pressure to come down in the foot and help it heal.
So if the horse
Putting,
chooses to lay down, it's not like colic, like we talked
no,
about last time. You do not want to get that horse up. If it's
yeah,
laminitis, you want to let them lay down
yeah,
on something soft and thick and cushy, whether they're standing or laying down.
right. And then, you know, depending on what your vet wants you to do, like sometimes I'll tell them, go ahead and give them some bute, get that bute on board before I even get there. Or if I'm really close, I'll just be like, okay, I'm headed your way. I'll see you shortly. Don't do anything. But the ones where you may have to wait for a vet for a little while, it's no carbohydrates being fed, get them in the soft squishy, give them some bute if your vet directs you to do that. And you can never go wrong with icing the feet. That's something that can
Mm,
help tremendously and it won't hurt. And so while you're waiting on your vet to get there, you just get those feet in whatever you can manage. I love the old IV bags because they hold up so nicely. A lot of people have soaking boots, getting them in buckets, whatever, but just get them in that icy water. And that alone will help decrease inflammation in the feet tremendously.
yeah, the ice has saved my butt more times than
Mm-hmm.
not while I'm waiting for a vet. And what I've done is a bag of ice or even ice cubes out of the house. Like you said, the best is to have old IV bags on hand that you gave me, cut the
Mm-hmm.
tops off, and those bags are so thick and solid. I just tape them. I
Yep.
just use duct tape. I fill them with ice and duct tape them around the pastern or the fetlock or the leg if I don't have a boot. But you can use any kind of canvas bag. You can use a thick plastic bag. You just want to get ice around the foot. And for horses standing up, they walk in it just fine. And
Yep.
I find even if they're a little skeptical and afraid of the ice and the bags on their feet, they feel the relief so fast that they just get used to it.
Yeah.
Like they don't react for long because the ice brings them instant relief to those feet.
Yes. Yeah. So that's number one. Like that's the easiest, cheapest thing you can do that'll make a world of difference
So if I
in their
don't have
pain
bute on
level.
hand, if I don't have a nice cushy stall, I can at least get ice on their feet.
Yep. If you live up north and have a cold stream on your property, go stick them in the stream. You know,
Ah,
it's like
yeah,
anything
that's
you can do.
get those feet cold.
Yeah. Just
Yeah.
get them cold because that does help tremendously.
So even like, well, in Florida, our water comes out of the ground over 70, but
Mhm.
in California, it was 40-degree water in
Yeah.
Colorado. So you could hose the feet, even if you have
Mhm.
very cold water, and get the inflammation down. And then if we do put ice on the feet, how long should, how just constant until the vet gets there? Or how long do we need to give them a break in between icing? Or how would you recommend that?
Constant is best if it's a true laminitis situation that you're trying to quiet those feet. And so my rule of thumb is usually leave them till the ice melts completely and the water is no longer cool to the touch. Then it's time to dump it out and add more. If you live up north and it's not gonna melt that quickly, then that gives you a little more time. In Florida, it can be a bear to keep them iced. But
Every hour.
yeah, you just keep dumping a little of the water because that's icy water is the
Is fine.
best
Yeah.
because it's nice and cool. And it's actually a little on the colder side than just the ice itself. So the melted ice is perfect.
So that gets through when to call the vet, the symptoms, the first aid while you're waiting for the vet. And they can have hay or something to eat or drink, but you just don't want to give them grain or have them eat sugar, anything sugary, anything
Yeah,
with lots of carbohydrates.
right. So you're cutting out that. And so like if you happen to have a hay that's grass hay, because those tend to be higher in the carbohydrates than your alfalfas and peanut hays, a thing you can do is soak that hay for an hour. Even an hour can make a difference where you just soak it in water for an hour, dump out all that water, and then feed them that wet hay. You've leached a good portion of the sugars out of that hay. And
Mm,
so you can soak it longer. It just depends on your environment. Like in Florida, it can get pretty sour pretty quickly.
mm.
And so that's where even just an hour of soaking will leach out a significant amount of sugar. So you don't like if it's a Sunday and there's no feed store open and you can't get different hay, you can do
And
that.
I have to share, especially for foundered horses where it's more chronic. you gave me the best tip for soaking hay I have ever come across, which is go get a big square laundry basket from Target,
Got it at
Walmart, the
Target.
dollar store, right? And a big
Mhm.
Rubbermaid solid tub. And you put the laundry basket in the tub, put the hay in the laundry basket, and then fill it with water. And after it's soaked at least an hour, you just pull the laundry basket out and drain it. And then I was feeding it to the horse straight in the laundry basket. It was awesome.
Perfect.
So instead of having to have a wheelbarrow full of water and all this wet, soppy hay you're trying to deal with, that laundry basket tip was awesome.
A client of mine came up with that. I saw it at her house and I was like, oh, that's brilliant.
It's brilliant.
Absolutely brilliant.
Yeah. Yeah. Because you just pull that whole laundry basket out, drain it off, feed it in the laundry basket to the horse. It was awesome.
Yeah.
Okay, so I digress on that, but that was for horses that do have metabolic issues or endocrine system issues, and they have to be on soaked hay regularly to reduce the sugar content. That was a great method to do that regularly. Okay, so we have first aid treatments, and then, well, it kind of ties into what are the things we can do to avoid or prevent laminitis in our horses. And the soaking of the hay, if we have a horse that is insulin resistant, Cushing's, super fat, just really heavy, then that's something we can do to help prevent a spike in carbohydrates.
Correct. Yeah, because as you said, that one is the most common. So your vet and your farrier are gonna know what to do as far as supporting limb laminitis. They're gonna know what to do if your horse is super sick with sepsis and all that. Because that's where, like, if I have the horse with raging diarrhea, one of the ways to prevent the laminitis is to go ahead and start icing their feet, even before they show signs of laminitis. So that is an excellent preventative. If you've got a horse that's just super sick with diarrhea, you just put their feet in ice, and that can help prevent that. And so then our most common one are those endocrine related ones. And this is where an ounce of prevention can be worth far more than a pound of cure. The things to watch for are first and foremost is your horse an easy keeper with that kind of look of being metabolic or Cushing's. And so everyone thinks Cushing's, it's that hairy hair coat. Well, that's the last sign. That's like the very last thing to come up. And it's the only thing that is caused, it's only caused by Cushing's. So it's what we call pathognomonic. So if you've got that hair coat that's curly and doesn't shed out, then there's no ifs, ands, or buts, your horse is Cushing's.
But it's when your horse looks like a chia pet that is just furry beyond furry, that thick hair that doesn't shed out. That's a definite sign of Cushing's.
Yeah, that's the only, that's if it has that, it's Cushing's. There's no other option. But it's that last symptom. So you're going to have the other things first that are going to be some indicators are just they'll start developing fat in abnormal places is one of the most common. So abnormal fat distribution is when they put fat up in the crest of their neck. They'll put it on their upper third of their thorax and abdomen area, that where it looks like a saddle pad basically, or they'll put it at their tail head. So right where the tail comes into the buttocks or comes out of the buttocks, there'll be fat right there. Those are all abnormal places to put fat.
That makes me think of every donkey I ever met.
Yes. And donkeys are such easy keepers. They're air plants. And it's like, if they get a little extra, and I'm guilty, my donkeys are fat and they get fed next to nothing, but they're on pasture. And so they just are air plants. And so donkeys tend to do it. Your Pasafinos and your Arabs will typically have a little bit of a neck crest. And then of course, also horses that were gelded late. So your geldings that were stallions until they were 15, they may have a more cresty neck as well, because that's part of the stallion physique. But
not necessarily a metabolic issue.
Correct. But the way to know for sure is if you've got, an Arab or a Paso that's starting to develop a cresty neck, test them. Just have your vet out I like to do what's called the Equine Metabolic Syndrome Panel, and I ship it up to Cornell University. and it tests the ACTH, which is the Cushing's associated. It tests the level of insulin and what it should be, or if it's high. It tests their thyroid level, because that can often decrease secondary to the insulin resistance and the Cushing's. It looks at leptin, which is a fat hormone, and that will go up in your metabolic horses, and it comes down a little bit faster than the insulin level does. So it's a nice one to kind of gauge your treatment. Are you improving things by getting that leptin to drop a little faster than the insulin well? And it also looks at blood glucose. And so it's a nice panel to kind of give you that full picture. And that's where, like, I have a client with 3 Arabs, and one of them went through a laminitis episode. We went ahead and tested all 3 of her Arabs, and one of them was older, and he was predominantly Cushing's, whereas the other 2 were predominantly metabolic syndrome or insulin resistant. And so all 3 of them, we've made changes to their diet. We've put them on some supplementations, some medicines, and they're all doing great. But it's one of those things where it's like she had the laminitis episode in one, and the other 2 looked similar. So we're like, let's just test all 3. And
so basically a blood work panel through your vet for metabolic issues. And that's going to cover your Cushing's, your insulin resistance, and any metabolic syndromes.
Yeah. So that's one of the first things you can do, is just do that test, and it gives you an idea. And that's basically is watching their weight. Don't let them get too fat. And that's, but they'll classically get that fat deposition in abnormal places. Your normal horse is going to put fat in their belly. They're going to get that big pregnant mare look. If they get the big pregnant mare look, they're just on some nice pasture and lots of good hay. But that's a normal fat horse. And
so if they start getting a cresty neck, or those fat saddlebags on either side of the back, or the fat over the tail head, that you might want to do a panel on.
Yes. Okay. Yeah. Because that's your abnormal fat deposition.
And if you have the Chia Pet long coat that's not winter related to where you live. Well,
Definitely.
even if they do, because there's horses that will put on those long coats in Florida, which has nothing to do with the weather here. But up in northern climates, where all the horses are putting on these long, heavy coats in the winter, it's the ones that are shedding out in the spring, patchy and slow.
They shed slowly. They might not shed thoroughly. They may shed most of it. And then they'll also, some of them that'll start growing some longer guard hairs where they almost look wiry. Those are kind of your earlier signs, because the hair coat is being produced because of the pituitary gland lives right next to the pineal gland, and Cushing's in horses is a benign tumor of the pituitary. Okay. And so the pituitary itself is getting bigger, and what it's doing is pressing on and influencing the pineal next to it. And so the pineal gland responds to daylight hours. So like now here in Florida, we're past June 21st. We're getting, each day is getting slightly shorter. Horses are starting to grow hair coats, even though it's still 90 freaking degrees and hot. But it's because the body is responding to the decreased sunlight.
Right.
That's what's stimulating the growth. And in a Cushing's horse, it's affected the pineal gland, that the pineal gland doesn't know what it is. It's like, is it light? Is it dark? I don't know. I'm just going to grow hair. And so they just keep growing hair. And so these are the horses where you can body clip them. And I've had some as quick as 6 weeks later, you're body clipping them again, because they're just not shedding it out. And we found that a lot of horses that stop sweating, that can be another indication of Cushing's disease. And so
the anhydrosis.
So if you've got a 17-year-old horse that everything seems fine, body condition's great, no fat, no foot soreness, it's trucking along, but all of a sudden stops sweating, I would recommend testing for Cushing's.
Oh,
because that can be one of the symptoms of it now. We've found that through the company that makes the drug to treat it sponsors some testing. And so they're encouraging testing of new horses, and they'll send it to the vet every so often. I get 2 free tests, and I just go to those horses that I'm like, maybe not. They've been kind of borderline, just kind of sitting in my head. Maybe we should test them. And the owners appreciate it because it's a free test. And the company is building this huge database. And that's where we found that by looking at all the symptoms we report on why we wanted to test this horse, anhydrosis kind of kept popping up and popping up. And so I consider it definitely a sudden onset anhydrosis. I put Cushing's as one of my differentials and test for it.
Right. And anhydrosis in Florida, we are all well aware of, but I've had clients in Maryland and Virginia also have horses go into anhydrosis, which is a sudden non-sweating. And the way a horse owner would know is basically on a hot day, all the other horses are dripping in sweat. This horse is dry with very little sweat to almost or absolutely no sweat and puffing. Like, to me, the puffing of the nostrils is the warning sign that my horse is starting to consider not sweating anymore.
Yeah. Or not sweating enough. You might see it after you ride the horse. It takes longer to recover a normal respiration rate. So just like you're saying, that puffiness, like let's say, typically when you ride your horse for 30 minutes doing whatever work in the arena and you come in, it puffs for 5 minutes. And then it recovers itself, or as soon as you hose it down, it immediately recovers. Like that's where, if that recovery rate is getting extended and it needs the hose down to recover, that's a horse that's not sweating enough or not sweating at all.
Okay.
Because they just need that cool down quickly. Because the reason they're breathing faster is to expel the heat through their lungs.
Right. So having a horse come in from pasture with nostrils flaring when they've just been out grazing is not a good sign. Or the longer it takes the horse to recover after a work session, not a good sign.
Yeah.
And interesting, that can be related to Cushing's and then related to laminitis. Ooh, it's a domino.
Yes.
Okay. Well, I think that covers all my questions. So let me just recap to make sure I understand it. Laminitis is an episode of inflammation in the itis means inflammation of something of the lamina, which is the very soft bloody tissue between the bone of the hoof and the wall of the hoof, right? Sandwiched in between. So when it becomes inflamed, there's no place for that pressure to go. So there's a risk of rotation in the bone or a sinking of the whole hoof capsule. And that can be caused by metabolic issues, which we've discussed, a toxicity. So if your horse gets in the feed room, I think you had to pump Prima's stomach once, my little. She's not afraid of small spaces and she's always hungry. She can unlock doors. So she's had her stomach pumped. And then mechanical, which could be due to an injury on another leg. The weight-bearing leg over time can start to show signs of stress. And then we talked about the symptoms and when to call the vet, with the most important being check for strong bounding pulses around the fetlocks of the front legs, kind of on the inside outside of the fetlock with your finger and thumb. And if you can feel a pulse, it's probably time to call the vet. You can ice the feet, hose the feet, cool those feet down while you're waiting. But check with the vet before you give bute or Banamine or anything like that.
Correct.
Okay. And I know there's a medication, I guess it's a steroid, Dexamethasone, that is closely linked to a laminitic episode. So like that's a medication I never give without the vet directing me to do so. But some people will give Dex for hives or other reasons, not realizing that they're risking laminitis. But why is there a high correlation between the dexamethasone and the laminitis?
We don't know for sure, and it's starting to kind of decrease a bit as far as like, is it the steroid itself, or is it the amount of steroid, or is it that like your horse is already in that low level insulin resistance or Cushing's, and what you've given them just kind of tipped them over the edge and affecting the blood flow to the feet. So that's
like
what
we
it's
talked
doing.
about kind of what we talked about with joint injections. So whenever you're giving steroids, there's a risk of too much or having them be on the borderline anyways and tipping them.
Yeah.
Okay. Got
and
it.
so I'm just judicious in who I give steroids to and for what reason and how much and which steroid. A lot of them are different because you can have your long acting ones that you can't take back. You can't, there's an injectable one that we can give in the muscle and the effects of it last 6 to 8 weeks. But if your horse gets laminitic 3 days later, it's got to go that 6 to 8 weeks dealing with that high steroid in its body, which is one reason like dexamethasone is preferable, because once you stop it, it's out of their bloodstream in 12 to 48 hours, depending on how much you gave. And so it leaves the body faster and deals with it. But there's still some studies going on, because for a while we thought the high steroid was creating a shunting of the blood away from the foot. Some people feel it's more what it's doing with the sugar levels in the body that then affect the blood flow to the foot, much like people with type 2 diabetes and poor circulation. And so it's just one of those where I just don't risk it if I have the concern about it. And usually that's based on horse history and body type. Is that, do I consider this horse to be a risk? But it can happen to any horse.
Right.
And so it's just one of those where the best thing to do is have that discussion with your vet before it happens, kind of thing. Like if you're giving steroids, and don't be scared of steroids because they can be life-saving.
Right.
We have a statement in veterinary medicine is let nothing die without the benefit of steroids. It's one of those things where if you feel like you can't fix this horse and you've tried everything, that's the one last thing to try. And in some cases, it's what that horse needed. And so don't fear steroids, but just be aware of possibilities and discuss with your vet, like, is there another option I could try first? Give that a week. And if that doesn't do the trick, then we can try doing the steroids. Because I have some cases with that. I've got one going right now with a horse that just has a really bad skin issue, but she's a big old heavy set warm blood that I'm like, she's a laminitic risk. So I don't want to jump to the steroids. I'm going to try some other things first. And if that doesn't do the trick, then I may still try, but the owner's aware of the risk. And so that's the key, is just the discussion and knowing the risks. And then the thing you can do is, as soon as that horse shows any symptoms of the laminitis, get those feet in ice and call the vet immediately. That's the key to it, is the faster you can stop it, the better the prognosis usually, unless it's one of those that's just a toxic insult or something. So.
But even with a toxic insult, it's like anything we can do to just reduce inflammation, just like for us, right? The bag of peas, it's like bag of frozen peas, just get ice on it and get it to calm down at least a little bit, that bounding pulse. Yeah. All right. Well, I think we will wrap it up there, but thank you, Dr. Gretchen Nelsen, for all of that really helpful information with horse owners, because laminitis is a death threat to our horses. Yeah. And I'm really happy you explained, really broke out metabolic versus toxic versus mechanical. 3 different reasons we can have laminitis. And I think it's just the design of the horse's legs and feet. Once you get inflammation in the foot with nowhere to go, and they're too sore, they can't walk, so you can't reduce that pressure through movement. And so it's like that can become really bad really fast for horses.
Yeah, and the stall confinement is because you've got that inflammation in there, so that lamina is not as strong as it should be, and every step the horse takes could potentially pull lamina apart and lead to more rotation. Damage. And so you have to look at it's from a physics point of view, that you've got a weakened structure holding that bone in place. At the same time, you've got the tensile strength of the deep digital flexor tendon pulling on that bone. And so it's a fight between the lamina and the deep digital flexor tendon. And you want to do everything you can to keep that lamina as strong as possible. And just being out and moving, every single step can potentially tear lamina. And so you just want to do what you can. And that's where, like, the ideal situation, what you would love to see if you could convince every horse to do it, is lay down in their stall with their feet in ice. That takes off all as much inflammation as possible and as quick as possible.
And so if people don't have a stall for the horse, at least get the horse confined.
Yes.
Like limit mobility, because even walking around, like I like the way you put it, it's just physics. You have a loose foot and you're putting weight on it in motion. It's going to break down. So so just getting the horse confined, getting the feet cooled down, and reduce movement to reduce damage or potential damage. Oh, thank you so much. That is really informative.
My pleasure.
And thank you for joining us for another episode of the Horse Geeks podcast. Please like, share, subscribe, and we will see you next time with a new topic. I think Gretchen's coming back to talk about eye ulcers at some point.
That's the other corneal ulcer.
Yes, that's the other every owner should know about topic. Yes. Okay. Thanks, everybody. We'll see you next time.
Thank you.